Good afternoon. Thank you for joining us for today's webinar, Identifying, Preventing, and Responding to Bullying in Long-Term Care Facilities. This is Amity Overall-Labe, Manager of Ombudsman Program and Policy with the National Ombudsman Resource Center. We're very fortunate today to have Dr. Robin Bonifas here with us to talk about her work regarding bullying in long-term care facilities. To give you a little bit of housekeeping tips in using GoToWebinar, you can see that right arrow, you can expand or collapse your control panel. Audio, you have two options. You can listen through your speakers or call in on the telephone. And as you heard at the very beginning, all lines are muted during the webinar. So if you have any questions, make sure to enter them in the box and we'll respond during the question and answer portion of the webinar. We will be recording today's webinar and it will be available on our website shortly after today's broadcast. Dr. Robin Bonifas is a John A. Hartford Faculty Scholar in Geriatric Social Work and an Associate Professor with the School of Social Work at Arizona State University. She has over 15 years of experience working with elders and their families in both long-term care and inpatient psychiatric settings. Her current projects examine elder social justice issues such as resident-to-resident aggression in nursing homes, late-life bullying, and other challenges to social relationships in senior care organizations. To start our webinar, Dr. Bonifas will discuss her recent work regarding bullying among residents in long-term care, reviewing the prevalence of bullying and how to identify, prevent, and respond to these incidents. There will be time for Q&A after her presentation. After the Q&A, I will share some resources regarding resident-to-resident mistreatment, discuss the role and responsibilities of ombudsmen regarding these incidents, and share some advocacy strategies. So why are we talking about bullying? We're talking about bullying because it happens. On the left-hand side of your screen, those are just a few examples of some headlines that made the news about bullying in the last couple of years. It happens, and sometimes no one notices except for the residents involved, or the resident that was bullied doesn't tell anyone, or the staff and family members downplay the bullying. Bullying and other forms of aggressive behavior often occurs due to the unmet needs of residents. Behavior is a form of communication and usually a warning sign that there's an underlying problem. Bullying has a significant negative impact on all residents involved, and each resident has the right to individualized quality care and to be free from mistreatment. So we need to learn more about it in order to better support all residents, help ensure their safety and well-being, and promote individualized care. According to the National Ombudsman Reporting System, NORC, data in 2013, there were 2,140 cases of resident-to-resident abuse, which is code A6, in nursing homes, and 642 in assisted living. Resident-to-resident abuse was the second most frequent complaint in category A, right under physical abuse. As most of you know, the codes in Category A are only used for abuse defined as willful mistreatment of residents. As the bars show on the right-hand side, there were over 5,000 complaints of resident conflict, code I-66 in nursing homes, and 1,589 in assisted living. Code I-66 is used for any complaint involving conflict between residents, including roommate conflict and inappropriate behaviors that impact another resident's quality of life. Two notable takeaways from this data is that in 2013, Code I-66 for resident conflict was among the top 10 complaints for both nursing homes and assisted living. It was number 4 in nursing homes and number 6 in assisted living. And there were more complaints of resident conflict than of any abuse code in Category A in both nursing homes and assisted living. Resident conflict, including bullying, depending on the situation, could escalate to abuse, and regardless of whether it's considered willful abuse or not, these conflicts can have a lasting negative impact on residents' quality of life and care. So this is an important issue that needs to be addressed. So with that overview, I want to turn the presentation over to Dr. Bonifas. Just give me 1 second to change presenter. There you go, and if you want to unmute your line.
Okay. I think everything's set to go.
Thank you. Yes, it is.
All right, very good. So thank you, everyone, for joining us today on this important topic. So just to give you an overview of what I'm going to talk about during the 45 minutes that we have together, I want to review the characteristics of bullying among older adults, give you some definitions, some example behaviors, so it's really clear what we're talking about, and then give you some examples and what we know about what is similar among people who do bully in late life, and what's similar, what are the characteristics among people who are the targets of bullying in late life. And then spend some time talking about the impact of bullying, how you recognize it, and a framework for addressing it. So that's how we'll spend our time together. So first of all, sort of a caveat is that very minimal research has been completed on bullying among older adults. We have a wealth of research and literature on bullying among youth in the school systems, bullying in the workplace, bullying in prisons, but not so much on bullying in late life. So the presentation, what I'm going to share with you today is based on 3 sources of information, and I want people to really understand where the information comes from. So first, it comes from my pilot study, which took place in 2 assisted living facilities. And then it's also informed by practice experience working with individuals and organizations who are impacted by senior bullying, and not just my experience, but the experience of my colleagues who share a lot of what they're struggling with and what they're working with and they're trying to address. And then that literature I mentioned on youth bullying and bullying in the workplace, bullying in prisons, there's a lot of good information there that's a foundation and that we can draw on to also understand what happens in late life. So those 3 sources of information guide what I'm presenting to you today. So, and I don't expect people to answer this question, of course, we're muted, but the idea is to think about, have you ever been bullied? And when I present this in face-to-face situations where we're not online, most everyone in the audience raises their hand. And if someone hasn't been bullied, they typically know somebody who has. So we know what it feels like. It doesn't feel good to be bullied. And it tends to happen, of course, in social situations. So people will talk about their what happened to them in school or what happened to them on the job, and there's a lot of emotions tied up with these experiences. So if you think about our older adults, you know, they're having a similar reaction, if not stronger, to being bullied, because they're also trying to deal with other types of issues. Imagine trying to deal with being bullied when you're also struggling with other losses in your life, when you're already struggling with a chronic illness or with depression or something like that. So we often hear sticks and stones may break my bones, but names will never hurt me, as sort of a way to minimize the impact of bullying. But it really brings up a lot of negative emotions, and we'll talk about that more as the presentation moves forward. So we are recognizing that bullying appears to occur across the lifespan. So it's not something that's just isolated among young people in the schools. It's not just isolated in the workplace, but it seems to occur in all settings where older adults spend long period of time. And by that I mean we don't really see it like in the doctor's office while people are waiting to see the doctor, although you do spend some time there. I mean where it's a communal living environment. We see it in nursing homes, we see it in assisted living, retirement housing, independent housing. We also see it in senior centers because people typically go to the senior center and they're there 5, 6, 7 hours, and there's enough context for bullying to occur. So it does appear to be a lifelong phenomenon. Next is the definition, so it's really clear. What are we talking about when we say the word bullying? It's important to start from the same foundation. And you can see in this little picture here an example of social bullying. We have 2 ladies sitting there knitting. Another woman comes up and wants to join their group, and they're purposely ignoring her, purposely putting down the purse so she cannot join in, so excluding her from the group. So here's the definition. Bullying is intentional, repetitive, aggressive behavior involving an imbalance of power or strength. So what we've noticed in our work is that, at least among older adults, that the need for repetitive exposure to aggressive behavior is questionable, because we've certainly seen, and I've heard about, incidents where it's just a one-time incident, a one-time event, a one-time occurrence that has significant negative impact on the individual. For example, there was a case in it was a senior center where a woman had moved to a new town, wanted to get to know people, so went to the senior center and wanted to join in the group there. And she was not allowed to sit down anywhere. I don't know what they were doing. There was some type of game going on or some type of event going on that she wanted to take part of. And the people who were there first were, no, you can't sit there, that seat's taken. No, you can't sit there, that seat's taken. And it was like every seat was taken. And she felt so unwelcome and so excluded that she vowed never to go back to the senior center. So it was just, a one-time exposure to that behavior that had a significant impact on that individual. Another type of bullying to be aware of is what we call relational aggression. It's very common among older adults, and it's non-physical aggression. So the woman I just talked about, no one hit her or kicked her or anything like that. It was entirely social bullying. And it's non-physical aggression that's intended to damage peer relationships and hinder social connections. So we see that very, very often among older adults. So within the definition, bullying includes these 3 types of behavior. We have verbal bullying, physical bullying, and antisocial or relationship bullying, where the relational aggression would fit in there. So here's some specific examples. So verbal bullying is your name calling, your teasing, your insults, taunting, threatening, being overly sarcastic, making pointed jokes that target specific individuals. So not just telling jokes, but telling jokes with purpose. So if you have an overweight person in the room, you're purposely telling fat jokes to target that person. That's what that means. Physical bullying is you're pushing, you're hitting, but also destroying property or stealing. And then antisocial bullying is shunning, excluding, gossiping, spreading rumors, and negative nonverbal body language. So mimicking is something that we see fairly often, where say an older person maybe has a speech impediment or has a a limp, so their walk is a little bit different. There'll be people who will mimic their speech or mimic their walk in a way to make fun of them. So that's a type of negative body language used as bullying. Okay. For some reason, my slides aren't wanting to move forward. Oh, there they go. Okay, my slides were bullying me a little bit. All right, so here in my research, what we did is we interviewed several people who lived in assisted living and asked them, what do the people you live with, what do they do that bothers you the most? So we specifically didn't use the word bullying because we wanted it to come more naturally from the people who live there. I mean, what bothers you? What do you find most problematic? And these are the symptoms, or these are the things that they reported that they find to be the most difficult, that what causes them the most distress. And again, this is in assisted living. So they talked about being exposed to loud arguments in communal areas where they didn't feel that they could escape from the argument in their vicinity. They talked about name calling and teasing, gossiping, being bossed around by other people living there. And they talked about the challenge in negotiating value differences, and that's sort of my nice way of talking, or my politically correct way about people had a really hard time with people who were from different socioeconomic status from them, or different lifestyle choices from them. That was something that was difficult. They talked about having a very hard time sharing scarce resources. So what that was about was getting into scuffles with people around who was going to get attention from the nurse, who was going to get attention from the activity coordinator, who was going to sit in the best chair, or who was going to choose the television program in the community room. So those types of issues. They also talked about the difficulty of being constantly hounded or harassed to make loans, typically of money or of cigarettes. Those were both very high commodities in the assisted living I worked with. They talked about listening to others complain, experiencing physical aggression, and witnessing psychiatric symptoms. So these are the top behaviors of other people they live with that bother them the most. And what I want you to notice about those the list is that not all of those things that they reported being problematic actually meet the definition of bullying. Certainly having other people with psychiatric symptoms around you is not bullying. Having someone get in a fight nearby you is not bullying. But the point is that for many people in assisted living, they seem to consider any behavior that is frightening or disturbing to be bullying, and they may identify it that way. And sometimes what happens in senior living organization from the management's perspective is sort of like, you know, well, that's not really bullying, or that's just an issue between residents. You need to figure that out, and you know, we don't really need to get involved. But I like to encourage management and other advocates to think about, even if it's not meeting the true definition of bullying, if it's something that's upsetting to residents, it's something that we need to try to minimize. And just because it doesn't meet the true definition of bullying doesn't mean that it doesn't feel like bullying to the person on the receiving end, and they may have the same negative emotional reaction. So that's something important to keep in mind. Here's some examples from quotes from my research participants when they're talking about things that happen to them, just so you can get an idea of some of the things that occur out there. There's one that tries to be the #1 tough guy. He comes up to me and says, "One of these days I'm going to smack you with a hammer." So the individual was very frightened by these threats, and we don't know if the other person actually had a hammer or intended to use it or anything like that, but it was just that threat was very upsetting to the individual who was told this on a regular basis. And he spent a lot of his time worrying about, is that gentleman going to be in the hallway today? Is he going to be in the dining room? Can I go into the TV room today, or is he going to be there and threaten him? So it was something that very much impacted his quality of life. The other one, he calls me fatso. He says, "Hey, fatso." Then as he goes down the hall, he would make oinking noises as he went to the elevator. So this is a woman who, of large body size, constantly ridiculed by somebody in the facility about her body size. Whenever she saw him, he would make these kinds of remarks, and it really affected her self-esteem. And we heard some statistics at the beginning of this presentation about how often resident-to-resident aggression occurs and how often resident conflict occurs in nursing homes and in assisted living facilities. Here's the data that came out of my study. We interviewed 30 people. 28 of them were able to describe at least one incident of bullying or negative social interaction that they had experienced since moving in. Beyond that, most of them had also witnessed others who were experienced bullying. So if you work out the number, there was a total of 134 people across these 2 assisted living facilities. So we can, 28 out of 134 roughly comes out to 20% of people experienced at least one, if not more, episode of bullying or similar behavior. And that's probably an underrepresented representation of the true amount of bullying, because there were likely people who had experienced bullying but just weren't comfortable coming forward to talk about it with our research team. Just a little bit about where does it occur, and I think I may have mentioned this early on. We see it across the continuum of care, wherever seniors congregate. So I don't know that I mentioned adult day health earlier, but certainly that's an area as well. So if there's seniors living there or spending any length of time there, likely there's potential for bullying behavior to occur. Other thing to be aware of is that engaging in bullying and relationally aggressive behaviors requires a certain level of cognitive and social skills. You have to be able to remember who it is that you don't like. You have to be able to plan how you're going to sort of get that person's goat. And the farther you move along in terms of cognitive impairment, the more difficult that is to do. So what that means is that senior environments where there's higher functioning residents or more higher functioning participants, we tend to see the most bullying occurring in those types of environments. For example, and I don't know that I have the slide in here, but I have a colleague who did a research study in independent senior housing. Now, mine is in assisted living, fairly high level of need there. But my colleague did a study in independent senior housing, and she found that 50% of the people came forward with at least one episode of bullying that they had experienced in the past year. So that's a difference. 20%, 50%, that's quite a large jump. So who bullies? Switching topics a little bit to share some of the common characteristics of people who bully. And these are sort of like, well, duh. But sometimes we don't think about these sorts of things. So They seek to control others. I mean, they find it reinforcing to be in charge and to be in control of people around them. Being powerful, that feels good to them. Even going beyond that, if they can gain power by making others feel threatened, fearful, or hurt, that there's a feeling of power, of strength that comes to them from doing that. And then they also find it reinforcing to cause and observe conflict between people. They also have difficulty tolerating individual differences. So they have a more narrow window of what's acceptable, and if someone is on either side of that narrow window, they have difficulty with that person and may target them as someone to bully. They lack empathy, meaning they have a hard time seeing other people's point of view, seeing how other people feel, seeing how their behavior affects others. And they are likely to have very few positive social relationships, so they don't have very many friends. And typically when people hear that, they go, well, of course not, they're bullies, who wants to be friends with them? And that may be true, but what we don't know is which comes first. Do you not have friends to begin with, and bullying behavior stems from that? It's like, well, nobody likes me anyway, might as well just be mean. Or is it the opposite, where you're bullying people and therefore people avoid you and you don't have any friends? I mean, we don't know what direction it goes, and it may be a little bit of both. What we need to keep in mind about bullying in late life, and what has come out in my research and repeatedly in talking with other colleagues who work with this population, is that among older adults, bullying seems to really be related to loss. So loss of valued roles in society, loss of social identity, loss of a sense of belonging. So they've just moved into a new assisted living facility, moved into a new nursing home or whatever, and trying to figure out who they are and how they fit in the world. They may not have the level of control that they're used to. So some of these people who engage in bullying behavior in late life may actually be seeking control at a time that in their life when they feel very powerless. And the negative behaviors may be attempts to try to regain some of their equilibrium. So I think if we can keep that in mind, it can help us in terms of identifying interventions that may be helpful, and can help us have a little bit of empathy towards the bully, that they're not necessarily this mean person, but they're having a very difficult time. They don't know how to deal with it, and the bullying behaviors is their way of coping. So here's an example of some people in my study talking about their challenges and some of the things that contributed to their negative behaviors. I have problems accepting their problems. That's one of the things that's hardest to deal with. So this individual was living with people who had a lot of challenges, and she just couldn't take that, and it caused her to kind of lash out at others. They go 2 generations back from me, and I don't know what they're talking about. So this person talking about the challenges of living in an environment where the ages range from 30 to 90, and that all the different values and beliefs across the cohorts, and feeling that it was sort of the young against the old, and not being able to get along. For me, the hardest part has been living with people I have never associated with in my life. So this person talked about how difficult it was living with people that she wouldn't choose to live with if it was her choice, and that was a very difficult place for her to be. We also noticed some gender differences in terms of bullying behavior, where women tend to engage in more passive-aggressive behavior, more of that social relational aggression type behavior, with gossiping and whispering and spreading rumors, sort of a mean girls type behavior, where the men were more likely to make negative, in-your-face comment, so a little bit more aggressive, where women being more passive-aggressive, which is interesting. This is another result that came out of my research, which I find very interesting, and I'm still trying to sort of wrap my mind around what it means. We found that people who bully report experiencing less lifetime trauma than people who do not bully. So it was quite significant difference. And I'm not sure what that is about, where people who were not bullies reported they had like 8 trauma experiences in their life, whereas people who bullied reported 5. So it's not an absence of trauma, it's just less trauma. So again, trying to understand that, and one of the things I'm trying to, I think, maybe going on here is just the idea that people who bully may have a less opportunity to develop empathy towards others because they've had fewer negative experiences. But again, that's just on my hunch. I need to research that more. But interesting finding. Switching topics here to talk about who gets bullied. So who's the target of these negative behaviors? And typically, they're people who have trouble defending themselves. And I don't mean to say that they cause the bullying. They don't. But there's something about certain individuals that just makes them attractive to people who want to power over them or domineer over them. So they do have trouble sticking up for themselves, defending themselves. And because of that, they often experience a great sense of powerlessness because to them, bullying really feels unpredictable to them. They don't know when the person's going to get them, so to speak. They don't know if I walk around down the hall and turn the corner, is he going to be there? So there's a lot of anxiety and powerlessness that they feel about trying to prevent bullying and protect themselves. We also recognize 2 types of targets. One we call the passive target, and the other is a provocative target. So passive targets, they tend to be highly emotional. They have a hard time reading social cues to really understand what's going on in the environment. They're typically perceived as shy and insecure, often very anxious. If dementia is present, it's early stages. So they're people that are just a little bit more timid and maybe the target of people who are looking for somebody to domineer. What we've also seen is that because people who bully have a low tolerance for people who are perceived as different, that sometimes people who are of racial or ethnic difference from the majority of the people in the organization, they may be the target, or people who have spiritual beliefs who are different, people who are from different sexual orientation. Sometimes those will, those characteristics will trigger bullying just because the person bullying not able to tolerate the different type of person. Whereas provocative targets are just more annoying or irritating to begin with. So they kind of intrude into other space, butt in, ask repetitive questions. They may lose their temper easily, and that behavior sort of gets to people who bully, and they'll target them based on those behaviors. So if dementia is present, it's typically a little bit more advanced for these people. Now, bullying, and we heard a little bit about that at the beginning, that it does have a significant negative impact on people. So here's, again, from my research, we asked them, when you experience these problematic behaviors, how does it affect you? And these are the most common types of things they talked about. I'm feeling very angry. I'm feeling like this ongoing sense of annoyance, which is a type of anger, frustration, fearfulness, anxiety. Some of them talked about retaliating. So they would get bullied or treated badly, and then they would treat that person badly in return. And then they would feel this horrible sense of shame and self-loathing that they had stooped to that level. They also talked about self-isolation, so staying in their rooms when they would rather be out as an effort to try to avoid the negative behavior. And they also talked about exacerbation of mental health conditions, so having depression already, bipolar disorder, anxiety, exposure to bullying, making that worse and making their symptoms more difficult to control. Here's some examples of what they had to say about the impact of bullying. It makes me burning mad. So not just angry, I mean burning mad. I mean there was a physical sensation to it. You can't get away from that certain person. It's hard, it's hard. She won't change. She does this to everybody, every day. It just aggravates the crap out of me. I like this quote because I get to say crap in front of 500 people or however many of you are out there, and it's perfectly legit. I just have to dodge him because he will altercate me. I have to try and avoid being harangued. If he hits me and I fall, I'll break a bone. This is a woman who a gentleman was constantly kind of picking on her, bumping her in the hallway, and teasing her, especially on the way to the elevator. And she was so fearful of him bumping her and her losing her balance, falling, and breaking her hip. I mean, in all of her day-to-day life was around being fearful about that and avoiding this gentleman because she was afraid of being pushed and falling. Also talked with him about how do you cope. What are the things that you do that help you manage these difficult behaviors? Coming from a strengths-based perspective, that people do have techniques that they're using that we can continue to encourage. So they talked about avoiding contact with a person who upset them and just walked away. And not walking away and self-isolating, but walking away and doing something else, getting involved in another group or talking with somebody who they enjoyed. Engaging in positive self-talk, so telling themselves, I'm a good person, I'm not a bad person, I'm an attractive person, so telling themselves these good things. Biting their tongue, so not engaging in a verbal fight with people. Pursuing activities on their own. Again, that's not self-isolating, but doing something that they enjoy by themselves rather than exposure to people who are unpleasant. Just letting it go, not letting them affect them, tuning it out. Some of them talked about trying to see the other person's point of view, and then, like, if that person is picking on me, perhaps there's something going on with them that I need to respect. Maybe they're having more pain today. Maybe they, they're worried about their grandson. So trying to maybe think a little bit about those sorts of things and have empathy for the person. Sometimes they would suggest alternatives. Instead of talking to people like that, why don't you do this other thing? Working to calm others down in the environment. They talked about spending time with their pets and focusing on relationships with people in their community that were supportive. So those were the things that they mentioned, healthy coping strategies. Some people, though, do have great difficulty coping. So when we looked at our data and sort of divided up people between those who were highly impacted by negative behaviors and those that were negatively not impacted, what we found is that people who were highly distressed by bullying and by negative behaviors, they reported greater levels of depression. That's the column there to the left. And they reported lower levels of self-esteem. So that was a real big difference. And again, this is cross-sectional data, so we don't know, does exposure to bullying cause depression and low self-esteem, or are people who are depressed with low self-esteem to begin with, are they the targets? And it may work both ways, but that's one of the differences we found. So how do you know if bullying may be occurring in a setting you're either working at or involved in? So these are some of the signs that we've noticed that people who are being bullied may exhibit. That self-isolation, people not coming out of their rooms, especially if coming out of their rooms and being involved with something that they did before. Somebody who's always been a bit of a recluse, that's not so much of a concern, but the new behavior of isolating. Avoidance of specific areas or activities, especially when that's a change. You know, they're fearful of going in the dining room. They're fearful of going in the community room. You know, I can't go to bingo, even though you know that they love bingo. We also see them taking very long, drawn-out, circuitous routes to get to and from communal areas. So they're going in a route that just doesn't make sense. You know, why do you have to go out of the building, down the alley, you know, through the storage room, and down this dark hallway to get to the dining room? I mean, sometimes they do that because they're avoiding a certain person who's been picking on them. They also tend to make vague complaints. So they don't like me, they won't let me. So it's not specifics, but some vague complaints about others somehow interfering with things. And then depressed mood can be a symptom as well, especially when it's in combination with some of these other things. Also, how do you tell if there's somebody in the building who's a bully? And here's some telltale signs. People who bully their peers also tend to intimidate staff. So they are very aggressive towards staff as well because they're sort of indiscriminate in their behavior. They're often telling others what to do in a very bossy style. They criticize others. They seem to lack empathy towards others' experience. And they often make repetitive complaints about others. And they typically complain about others in a very powerful outrage style that others are picking on them and bullying them. And when that happens, typically what it is that the person is bullying others, and then others are lashing out, saying, hey, don't treat me that way. And the person is reacting to that, and then, oh, they're picking on me, when it's really their behavior that's contributing to that. So those are some of the characteristics we've noted. So here's where I'm going to switch gears a little bit. We've learned a lot about bullying and its characteristics, so talking a little bit about intervention and how can we address it. Check my time real quick. So really, I see bullying behavior as something that needs to be addressed at the organizational level. So it's not just, you know, oh, we need to fix the bully, but we need to fix the culture of the setting so that bullying isn't tolerated. So I see it as a three-tiered intervention model where we're working to prevent and minimize bullying at multiple levels. So at the organizational level, at the bullying level, and at the victim or target level. And of those, I really see that the organizational level intervention is very critical. So it's really working to create that cultural change where the organization takes on more of a caring community aspect, where caring for others, and by caring I mean, you know, feeling and exhibiting concern and empathy for other people, and empathy being the ability to recognize and share feelings that are experienced by another. So having those types of qualities being very, very highly valued within the organization and increasing empathy is really the best antidote to bullying. So how do you do this? I mean, you don't just, there's no button that you push and, oh, non-caring, and push the button and now we're caring. I mean, it is a process. It does take time, but it's around promoting a culture of respect so that everyone living there, everyone working there, that, you know, respect and respectful interaction is very important to what we're all about. Holding people accountable and responsible for their behavior, making it comfortable to stand up for what's right, and helping people to build trust for one another. Again, I'm not saying that's something easy to do, but it's something that we can work towards that helps create that culture that minimizes bullying. Some of the interventions that are being tried out there, one of them is civility training. So helping people to really be reminded and be helped to practice civil interaction. So they teach 9 tools of civility: paying attention, listening, being inclusive, not gossiping, being respectful, being agreeable, how to apologize, how to give constructive criticism, how to take responsibility. So again, this is going to work in the type of setting where you have higher functioning people who can remember and build on these trainings, but the idea of really having this concentrated effort on civility and civility interaction, and helping people to have the tools to be able to do that, and recognizing that, you know, living in a communal environment is difficult. We're going to have disagreements. We're going to have people that we're just not comfortable with. How do we deal that in a civil way? So that's what that training is about. It's more appropriate for independent senior housing or high-functioning assisted living than it would be for a nursing home setting, but you could do some of that in a nursing home as well. Regular trainings for both staff and residents are very key to discuss and process and troubleshoot the challenges around communal living. Staff training and support about how do you recognize and respond to bullying. Sometimes what happens is staff are reluctant to get involved because they're afraid that they're somehow going to offend residents or tenants, or they're going to violate resident rights in some way. Policies and procedures that guide behavior are really, really helpful to have it actually spelled out. Here's the expectations of people living in this environment. Here's what we expect in terms of how we treat one another. And then, you know, that there's a system in place to report when people violate the expectations. Here's some example strategies that I've seen used to try to create that culture of caring. Acknowledging members of the community that go out of their way to make others welcome. So making a big deal about people who are kind to others. So a way to get recognition and be valued is by positive inclusive behavior. Noticing acts of kindness and publicly rewarding them. And then also training residents in bystander intervention strategies so that when they see bullying occurring and there's no staff member around, that they have the skills to go and break that up in a respectful, safe way. And here's just an example of the kind of things that might be taught in a bystander training intervention. Of course, it would be much more detailed than this, but just to give you an example, they teach them about bullying culture and the cycle of bullying aggression, where the person's, you know, they target the victims. People who are observing may actually participate in that. They're not intervening, which empowers the bully to continue, and the cycle progresses. So they would present those types of things about why is it important to intervene, because then you can break that cycle. In terms of interventions for people who bully, setting consistent limits is important. At the same time, recognizing that the person may be struggling with loss, may be struggling with trying to adapt to this new environment, and helping them to have an appropriate outlet to vent their frustrations. I mean, if they have a limited tolerance, they have a limited tolerance, and they need to be able to talk about that in a safe place. Helping them to identify other methods to feel in control that are maybe healthier. Helping them to learn positive communication skills, helping them to develop empathy, expanding their social network, and addressing underlying feelings of loss. In terms of people who are bullied, whatever we can do to help foster a sense of self-worth and dignity, so we're bolstering their self-esteem. If there is underlying depression, to recognize that and arrange for treatment. And then working on skills to help them avoid being victimized. You know, it's just basic skills on standing up for one's rights, managing anger. One of the things that we notice with people who are bullied is they're very, very angry. And they need to be able to process that and deal with that, and then help them to learn communication strategies. And, you know, from my perspective, if we can help a victim of bullying to get to the point where they can actually go and report the problem that they're having and get help, I mean, that's a significant step, because many times they just suffer in silence. So even that basic step of being able to come forward and say, hey, this happened to me, is a step in the right direction. My research participants had a lot of great ideas too, and we asked them, well, how do we get a handle on this problem? How can we make this environment more comfortable with less negative interaction and bullying? They thought anger management classes would be very helpful for some people. They wanted to have, you know, strong limit setting from management when people who were picking on other people, to the point of being able to give eviction notices if things didn't improve. They wanted to see regular meetings to promote communication between residents or tenants. They wanted clear rules and expectations for behaviors, and they really see management as a partnership between resident and administration. So they had some really good ideas about how we can get a handle on this. The folks in my study, they decided that they wanted to develop their own intervention. So I'll tell you a little bit about that before we end. They decided to do what they call this peace learning circle. That we had a psychology student who introduced the idea, and they embraced that, and they wanted to come up with something that used that model. So they designed this group event to help people recognize problem behaviors. And then it was sort of a bystander intervention idea as well. So they wanted people to be able to recognize problem behaviors when they occur, and then to have just some simple strategies that could call attention to the problem and sort of diffuse it. So they developed that. It was a half-an-hour event that they planned, and they did it, and it was just a complete flop. They found that the people who attended, their attention spans, they couldn't follow for 30 minutes, and then they got tired, and it just really interfered with what they were trying to do. And of course, the people who really needed to be there didn't show up. And I was very proud of them, because rather than giving up, they said, hey, what we developed didn't fit our population, let's rework it. So they took their idea, and they realized that everyone went to the religious service every week. So they incorporated this sort of bystander intervention approach into the religious service. They talked to the priest, can we have this be a regular part of the service? It fit well with the teachings, and so that was something that occurred every week, where they would spend a little time talking about, you know, doing good unto others and those sorts of things. And then they also had this calendar in the hallway where all the activities for the day or the month were posted. I'm sure you're all familiar with that. And of course, everybody was always looking at the calendar. So they decided they would put like an inspirational thought of the week on the calendar every week, and it was always something that prompted caring and compassion and those types of things. And I didn't measure the outcome of their intervention, but they felt that they had made an impact and that relationships have improved. So that's something very easy that can be done. And that is the end of what I wanted to present. Let's see how we're doing on time. Oh, I went over 4 minutes. My apologies for that. I should have had the clock right in front of me.
No, it was great. Thank you. So much information. I really, really enjoyed the specific examples at the very end when you were wrapping up. So thank you. And we do have some questions coming in.
Oh, wonderful.
So I'm going to go ahead and ask. The first one was, how to do organizational interventions in a business model org versus a social-centered model?
That is a challenging one, and my just initial thoughts on that are helping the business-minded folks to understand how minimizing bullying, minimizing relationship difficulties is going to help sell the organization. So tying in improved relationships, improved comfort, improved safety to the bottom line.
Fantastic.
Everybody wants to come to a building where it's pleasant and people are nice and all of that.
Exactly.
Mm-hmm.
Another question was, do people who regularly bully others know that they are negatively affecting others?
No. Typically they do not, and that's one of the challenges in trying to intervene, because we would all love to go up to the bully and, you know, hey, did you know that you're having all these problems and that you're a bully? And then they say, oh yes, please help me with that. No, it's usually they're in complete denial of the behavior and that they're having any impact, and it's sort of like there's nothing wrong with me, it's the world that's wrong. Mm-hmm. So it's very challenging.
Right. A question from an ombudsman, and I think I see they're already thinking about in-service training on this topic for facility staff. The question was whether you've ever thought about putting together a training video on this topic.
Oh, that would be an awesome idea. I like that. I would get like Cindy Crawford to play me, and it would be good. No, I mean that's the thing. I don't want to like be the star of it. But that would be a really good idea to have getting this type of information out where it can be used, you know, very accessible on an easy basis. I am writing a book that sort of puts all this information together, so I need to get that finished, or the publisher is going to bully me, but that might be a next step, to have it be a video, because you can't like hand a book to your staff and say, read this book. I mean, it's much better to have a video that you show and discuss, so that's a great idea.
Right. Great. Thank you. Tying back to your research and talking about that book, a question was asked where they can access the results of your study.
If you just email me, I will send you different PowerPoint presentations and poster presentations I've done. The article that presents the results is still under review, so I can't share that, but I can certainly share my conference presentations and poster presentations that summarize the results.
Okay, great. Thank you. Another question went back to your slide about interventions. What does setting limits on bullying behavior mean?
It means that when somebody is engaging in some of these negative behaviors, that somebody is saying to them, hey, it's not okay. You can't save seats when the entertainer is here. Seats are open to everybody. You know, so it's calling out their behavior, and I don't mean in a ridiculing way, but to let the person know that their behavior is not acceptable, and then, you know, giving them an alternative of, you know, you can't save seats, but you know, you can wait for your friends outside and I'll come in together, or, you know, giving them some type of alternative.
Right. Great. Thank you. Just being very clear about what is acceptable and what's not, basically.
Yeah, exactly. And that's where the policies and procedures can help, because then you can tie back your limit setting to the policies, and it makes it so you know, remember our policy is no shared seats, and it just diffuses the tension so they're not totally mad at you.
Yes, exactly.
Yeah.
Another question that I think a lot of ombudsmen and others on the call will have seen this in the homes that they visit, was that many of the nursing homes I go into have mixed ages. How would you address it with such a different population, different age range in the population?
That's another challenge, and I know the folks in my assisted living study, they talked about how difficult it is to live with these diverse ages who have just different values and ways of thinking about things. And, you know, I don't know that we need to have like segregated units or anything like that, but I think that there's a place for ongoing discussion and ongoing support group type things where people have the opportunity to talk about the challenges of communal living and the challenges of living with people that you never choose to live with, and supporting them in that way.
Great, thank you.
Mm-hmm.
We just have time for perhaps one more question. And it's about there were several questions that came in, a few of them actually about how to deal with staff bullying residents, which isn't the topic of this call, but definitely something NORC could work on in the future and consider in the future for training. But one question was, how do you set limits on bullying in facilities without impeding on resident rights? So striking that balance.
Yeah, that's hard too, and I know that's something that staff worry about, and they're reluctant to intervene because they're afraid that they're going to infringe on resident rights. And it's just important to keep in mind that residents have a right to a safe and comfortable environment. And if someone is making it so it's not safe and it's not comfortable, you know, there's that obligation to intervene, and it just needs to be done in a respectful way. So you don't call out the person behavior, you know, in a crowd where they're going to look stupid or be shamed. You know, you're going to want to talk to them about their behavior in private, and come at it with the understanding that there's likely something deeper going on with this person that's contributing to the behavior. So dealing with it with an attitude of respect, with an attitude of empathy that, you know, this is not just a mean person, it's more than that. And, you know, just being clear that, you know, Mr. Jones, we love you, but this behavior that happens in the dining room is not something that we can have continue. Can we talk about that a little bit more? So kind of coming at it from that perspective of wanting to work with him to help him improve.
Right. Thank you. And since we did have several questions that we don't have time to answer today, I'll review them. We have all the questions in our chat field, so I'll review them, and if it's okay, I'll get with you after the webinar and see if there's any way we can address those after the webinar.
Yeah, that would be fine. You know, I can maybe answer them and somebody could type them up or something like that. So
great. Thank you so much. Okay, so we're going to move to the next portion of our webinar, closing out and reviewing some resources. So I'd like to briefly touch on some ombudsman advocacy considerations for individual cases involving bullying. After receiving permission to pursue a complaint from either the resident or legal representative, some fundamental ombudsman advocacy considerations include the following, but are not limited to, of course. Supporting the resident as much as the resident wants you involved during the entire complaint investigation process. Seek direction from the resident regarding their resolution goal, and provide information about available services. For example, counseling, working with a facility social worker, even talking about some of the interventions that Dr. Bonifas talked about with the learning circle, and really promoting a bully-free environment. Provide information about resident rights and communication skills to help empower the resident, the person that was impacted by this. Communicate with your supervisor and follow applicable state program policies and procedures. For example, in a situation that involves two residents, consult with your supervisor to determine whether you can advocate for both of them, or if you need to pull in another ombudsman so each individual in that situation has an advocate. Because as we've discussed today, these type of incidents often have a root cause, and it's a way of communicating an unmet need. So the person that bullied the other resident also needs support and a full assessment and to see how we can meet that person's needs in order to stop this type of treatment of others. Advocate for documentation of the incident and care planning and assessment for each resident that was involved. Discuss common characteristics like you learned and heard about today about those that bully and those that are bullied, and how those characteristics apply to the individuals involved in this particular complaint and how to address their needs. For example, if there is a sense of loss that person's feeling and they need to regain control, how can that be focused and addressed? Or address self-confidence and empowerment for the person that was bullied. Share information with the facility staff about responding to and preventing future incidents of bullying. And of course, remind them about reporting if it's willful abuse and meets that definition of willful abuse. And address proper staff supervision and training. And if you do have some training materials offered to provide in-service training. Now that you've learned more about bullying, the characteristics of those that bully and the targets of bullying, the impact of it, and how to recognize it and intervene, here are 4 things you can do right now to help ensure the safety and quality of care and life of all residents. Speak with residents and resident councils about this. Open up a dialogue about this. As you've heard today, a lot of victims of bullying don't come forward for fear of retaliation. They live in that community and so on. So make it a safe place for them to communicate with you. Talk about their rights, especially their right to be free from mistreatment. Share tools of empowerment and effective communication. And of course, encourage reporting of incidents and stress the importance of supporting each other and fostering a bully-free community. Speak with family members and family councils about the signs of bullying, how to support their loved ones, and how to report incidents. Speak with the facility staff about bullying. Share what you've learned today. Share resources that you're going to hear about in a couple slides. And of course, include information regarding bullying and ombudsman training. In addition to individual advocacy and education, systems advocacy is an effective approach in addressing bullying. Make sure to review your complaint data. Just looking at the numbers from the NORC data that I talked about at the beginning of the webinar, look at that for your program. How many complaints do you handle regarding resident conflict? What about resident-to-resident abuse? Are there any trends that you can identify? Can you identify any root causes or systemic issues that need to be addressed? For example, is there a lack of individualized care planning and assessment? A lack of meaningful activities, or perhaps it's an issue with appropriate staffing levels or staff training that you could address systemically. Identify areas for education and collaboration and advocacy. Again, share this information with others and identify with partners to work with on this issue, maybe some mental health professionals or adult protective services or a regional elder abuse task force. And of course, consult with your supervisor and/or state ombudsman to coordinate your advocacy efforts. Before moving on to the resource slides, I wanted to remind you of some important ombudsman fundamentals regarding this issue. Aggressive behavior, as you've heard several times, is often a form of communication, so we really need to identify the root cause, and ombudsmen need to advocate and continually talk about identifying the root cause of this behavior. Ombudsmen use a person-centered complaint processing approach. You follow their lead. It's the resident resolution goal is resident satisfaction and the protection of residents' health, welfare, and rights. Ombudsmen are not the official finder of fact to substantiate abuse complaints, so therefore you're not there in a regulatory role to seek evidence to prove the allegation occurred in order to determine whether there was a violation of regulation or law. You're there to support the resident and come to their satisfaction with the resolution. And ombudsmen are not mandatory reporters, but you must support the resident to the extent that they want your assistance. So sharing some resources with you that you can go to our website today and get a few of them, and then this one in particular will be released in the very near future. It's a technical assistance brief, and the topic is Ombudsman Advocacy, Resident-to-Resident Aggression. It provides information regarding resident-to-resident aggression. It provides tips to help for ombudsmen to help prevent and reduce the prevalence of RRA, and it also provides some advocacy strategies. So this will be a resource that you could use in your ombudsman training as a way to open up that training topic, or maybe continuing education or something of that nature. Consumer Voice also has these fact sheets about resident mistreatment. It defines abuse, neglect, and exploitation, as well as defining resident-to-resident mistreatment. It is a consumer fact sheet that you can share with facilities, to share with residents. You could share with resident and family councils, and so on. And it's available at that link in the slide. And for ombudsmen specifically, we also have a technical assistance guide about responding to allegations of abuse, the role and responsibilities of ombudsmen. It provides key points, the federal statements from the Administration on Aging, and the federal requirements about the ombudsman role in this and investigating these type of complaints. Additional information is available on the NORC website. Here are some links that take you directly to our elder abuse issue page, as well as our training page. As I said before, this webinar is being recorded and will be posted on our website, as in addition to some links to the resources I mentioned today. So you'll be able to find it in our website in a couple days. In closing, I'd like to thank Dr. Bonifas for her excellent presentation, and thank you all for joining us today. The webinar recording and all materials will be posted shortly. For additional resources, visit our website, and if you're looking for something specific or have questions or comments following this webinar, please let us know. My contact information is on this slide. Also, once the webinar ends, you'll be directed to a quick evaluation, and we really encourage you to complete the evaluation, as your feedback is very important to us. So thank you so much for your time. This is obviously a very hot topic. These were excellent questions, and I'll do my best to gather those questions and respond to those that weren't able to get to today. So thank you very much, and have a wonderful rest of your afternoon. Take care.